IAHCSMM CRCST Exam Practice Test 2026 New Updated 30 Questions Answers. Question 1. Lumen items should be cleaned with a sponge, a brush of appropriate size, water only, air. Brushing the internal channel is critical. Question 2. Items should be loaded into an autoclave. Tightly. Loosely / not touching walls. Stacking flat. In plastic bags. Allows steam circulation. Question 3. Personal protective equipment, PPE, in Deccan includes just gloves, gown, gloves, mask, eye protection, street clothes, scrubs only. Full coverage for biohazard protection. Question 4. A Class 5 indicator is an chemical indicator, biological indicator, physical monitor, integrator. Class 5 integrating indicators react to all critical parameters. Question 5. Critical items entering tissue / vessels require low-level disinfection, cleaning only, sterilization, intermediate disinfection. Spalding classification. Question 6. Peel pouches should be placed flat, on edge, tightly packed, under heavy trays. On edge, paper to plastic, for air removal and steam penetration. Question 7. The sterile storage area should have high humidity, positive pressure, negative pressure, carpet. Positive pressure keeps contaminants out. Question 8. Enzymatic cleaners break down metal, plastic, organic matter, proteins / blood, glass. Designed to digest by burden. Question 9. What is the dirty area of the SPD called? Assembly, decontamination, sterilization, storage. Deccan is where soiled items are received. Question 10. By burden is the weight of a tray, the amount of microbial contamination on an object, the cost of sterilization, a type of germ, number of microbes on an item before sterilization. Question 11. Pass-through windows are used for fresh air, moving items between Deccan and assembly, ordering lunch, talking to doctors. Maintains environmental separation. Question 12. What is wet pack? A moist towel. Moisture found inside a package after sterilization. A type of cleaning. A soaking method. Indicates a failed sterilization process / drying. Question 13. Which agency regulates medical devices? USDA, FDA, EPA, CDC. Food and Drug Administration. Question 14. The most common sterilization method is dry heat, ethylene oxide, steam autoclave, bleach. Steam is efficient and fast. Question 15. Ethylene oxide ETO requires short cycles, aeration, high heat, water. Aeration is needed to remove toxic gas residue. Question 16. Flash sterilization is now called quick cycle. IUSS, immediate use steam sterilization. Prevac. Gravity. IUSS is the modern term. Question 17. Water temperature for manual cleaning should be boiling, lukewarm/cool, per IFU, freezing, hot. Too hot can coagulate proteins, blood, onto the instrument. Question 18. What is cavitation? Cleaning in ultrasound. A hole in a tooth. Sterilizer cycle. Packing method. Process used in ultrasonic cleaners. Question 19. Relative humidity in sterile storage should be 10 to 20%, 30 to 60%, 70 to 90%, 0%. ANSI/AMI ST79 recommends 30 to 60%. Question 20. Biological indicators, BIs, should be run how often? Monthly. Weekly, ideally daily. Yearly. Never. Daily or at least weekly depending on facility policies/standards.